Well, just to let you know that we're recording, as I mentioned in the email, we're recording the first part of this workshop, which will be more sort of presentation based. And then the second part of the workshop will be more discussion, and we won't be recording that. So feel free to speak freely. And then we hope that's going to be a really nice opportunity to hear about everyone's different experiences and perspectives. We've got a range of people from different nations, different backgrounds, different organizations here. So I hope that will make for some really nice chat. We had a similar workshop this morning with more of a regional focus, and we had some great stuff there with people from bus operators, public transport, public health, and public transport within sort of local authorities. So so I'm very much looking forward to that. But let me first introduce the session. So this is our team here, the Roots of Infection, Roots to Safety. And our project is called Creative Mapping of Human Viral Behaviours on the Bus to Understand Infection Prevention Practices. So this is a project funded by UK Research and Innovation through the Arts and Humanities Research Council. So that's money from central government that's come through the Research Council as part of a programme of research in kind of rapid response to COVID-19. And this is us here, Emma Rose, the lead on the project. And then I'm a researcher also at Southampton. We're both at Southampton in geography and environmental science. Sandra Wilks is also at Southampton in health sciences, and Charlotte Veal is at Newcastle University in landscape architecture and planning. And the four of us have been working together on a series of projects over a number of years and have come together earlier this year to begin this project around COVID and public transport. So what we're going to be doing this afternoon, Emma's going to give a bit of an overview of the research that we've been doing. And she's also going to be talking a bit about the sort of bus environment as it's been distorted by, or what she's talking about as a kind of changing microbial landscape. So how the experience of being on the bus and the environment of the bus has changed throughout the pandemic. Sandra will be talking about the bus microbiome and known unknowns. So the sort of the outcomes of the sort of scientific microbiological study that she's been undertaking on buses. Charlotte Bill will be talking about cultures of information and misinformation. So how people are kind of knowing around the pandemic what we're, the knowledge that we're basing our kind of actions and behaviours and changing kind of policy stuff on. And then we've got Dawn Badminton-Capps from Bus Users, who we're very pleased is here with us today, and who we've been in dialogue throughout the project. And Dawn's going to be giving the view from Bus Users UK, who most of you will probably know is a charity representing bus users and kind of lobby group for bus users. If I said that correctly, I'm sure Dawn will correct me. And then, as I said, the second part, we'll have a bit of a discussion. So we look forward to hearing more from you all there. And just hello and welcome to Catherine, a late arrival there. You've not missed much. But just to let you know that this part of the session is being recorded, but the second half of the discussion won't be. Welcome to Emily, who's just joining. So let me hand over now to Emma.
Yeah, thanks, Paul. So if we move to the next slide, I'm just going to quickly talk to you about the methodology. So essentially, we're a team that came together because we had expertise in trying to understand human relations to the microbial world. We've never before actually studied public transport. So there are lots of kind of transport experts out there. And I guess we're newcomers to the field. And I suspect many of you are feeling like this as newcomers to the field in terms of how the world of public transport intersects with the public health crisis in terms of being asked to kind of implement or ensure that certain infection prevention measures are actually being carried out on the bus, and what implications there are for your bus passengers and your drivers and cleaners. So we're kind of coming in with a bit more of a thinking, particularly about that microbial world. But importantly, not only from a scientific side, because we have a microbiome study led by Sandra Wilks, our microbiologist, but also from the social science side. So this is a really new area of social science to try and improve understanding of the way in which society grapples with that invisible world of the microbiome. And it's interesting that we've thought about it in terms of pathogens, and obviously the pandemic and the COVID-19 virus, and the fact that it's invisible and it hangs in the air and isn't actually, it seems, transferred that much through surfaces, has kind of raised new challenges again about how we grapple with the air around us and the fact that it may be carrying something that is a potential risk to us. So we've done 50 hours of ethnography on the buses, at bus stops, observing how people have been behaving, catching the buses ourselves, seeing what the environment was like. Obviously, this went from February earlier on this year when we were still in lockdown, and there were kind of limitations on the number of people that could catch the bus, and definitely a much stronger mandate to wear a mask back then, and a lot more apprehension of being too close to other people, through later on this year, the summer, where things started to ease quite a lot. And actually earlier on this autumn, it felt like we were getting back to normal. And, you know, much less wearing of masks, and no visible stickers on the buses that there was anything to worry about. No requests to necessarily wear a mask or keep the windows open. Certainly no restrictions about capacity. We followed that up with 37 semi-structured interviews. So we've spoken to bus drivers and also bus cleaners about their experiences, not only of cleaning the bus, but also of the pandemic itself. And that includes bus drivers as well. You know, broadly, what has their experience been living and working in this changed world? And we've also spoken to 22 bus passengers. And perhaps most interestingly is that we made a commitment that over 50% of the people that we'd speak to would come from a Black, Asian, minority ethnic background. And so we have followed that up by working very closely with a Bristol-based Somali community. And so over 50% of the people we've spoken to have actually been drawn from the Somali community. And they're obviously often an underrepresented group in these kinds of studies. So we're particularly pleased that we've managed to, you know, hear a lot from them, a community that depends a lot on using the bus. So as I said, then we had the microbiome study, which Sandra will be telling you a bit about. And then we've also been developing creative outputs. We've been trying to draw on our learning from speaking to people, from doing the ethnography, from the microbiological aspects, and from what is being learnt about COVID and different ways in which we can protect ourselves and prevent COVID-19 transmission, to develop some public education films. And we'll be talking about those right at the end. Okay, so let's move on to the next bit. So I just want to use this term, the distorted bus environment, to kind of make you think about what has changed over the course of the pandemic. People used to leave the house, catch the bus, and they would very rarely think about the bus environment. But of course, from the start of the first lockdown, we started to be told to avoid public transport and to actually avoid being in close proximity to other people. So this term distorted, I think, is a way for us to kind of find a language to talk about how the bus has changed in terms of how it's appeared, how visually it has looked different, and also how it has felt different. Next slide, please, Paul. And the way in which we can add to that sense of distortion in terms of explaining and describing what has changed is to start to think about the microbial landscape within the bus has changed. So you're probably familiar with the term landscape, countryside landscape, urban landscapes, and the fact is that the way in which people read the countryside or read an urban landscape is strongly affected by their own kind of feelings about particular aspects of that environment. So we see landscape as a term within geography that kind of entangles both human perceptions and the physical aspects of the environment. So that's why we find that it's useful for us to think about it in terms of the microbial, because we're actually, if we think about all these very different ways in which we've learned to behave through the pandemic, it's because something has changed in the microbial world. There is this risk of the virus, or the virus could be present, and it's also had implications in how people think about other sources of dirt or anxiety about touching surfaces. So the microbial landscape is what has changed. That is what has distorted the bus environment. So, and it's not only the bus architecture So, you know, whether there was particular seats that you couldn't sit in, but also the behaviour of other passenger bodies, that they are also part of the landscape on the bus, and also are being shaped by this microbial landscape in terms of how they're behaving, like wearing a mask, for example. So getting onto a bus, say a month ago, where very few people were wearing masks and everyone was sitting next to each other, at one level was very comforting, because it kind of feels like everything is back to normal, and you're like thinking, well, is there a risk anymore? But now we've gone back to a world where you've got to wear masks again. There's that new sense of kind of apprehension starting to reappear. But of course, we know that there are many people who continue to not board the bus again, who've kind of maintained their level of caution. And they're, you know, a really important group to try and think about why is it and what is it that might help them have confidence to move back on the bus. But we're trying to find out how can we articulate this public health challenge within the space of the environment. Okay, next slide, please, Paul. So this is a diagram that we're trying to work on and develop, which to try and present this concept of the microbial landscape, to realise that we've got human of people's understandings, which we've kind of learned a lot about through our interviews and ethnographies in terms of the way people have been behaving, but how that is continually being shaped and changing and evolving as we've moved through the pandemic, and how, you know, new strains from Alpha all the way through to Omicron have had different implications on how people have felt when they've been on the bus. And government guidance has also been thrown into that mix in terms of what has been the government guidance. But the government can give guidance at any point, but it's about really whether anybody is actually listening and who is listening, who follows the news. There's been also a trend to people not wanting to carry on hearing the bad COVID news. So then we find that it's more and more important that people learn about how to behave because of what they see other people doing. So that's actually really important in actually giving people a sense of how they should behave right now in the pandemic. Okay, next slide, please, Paul. And I guess the main thing that I would like you to take away from today is that what came across really strongly in our sets of interviews and also in our ethnography is how little people had grasped the idea, the concept of fresh air. So remember, hands, face, space, and fresh air was actually only added in April of this year. And that messaging seems to be really poorly known in relation to the bus environment. There certainly were stickers on bus windows, but we also found that people hadn't really noticed them and certainly didn't understand what they meant in relationship to the pandemic. The messaging around the fact that COVID is actually more an airborne risk to ourselves rather than a touch base like many other pathogens like flu or norovirus really has still not been strongly disseminated or understood by the population. So, for example, in our interviews, we found, although we were seeking people to talk to us about this, but very few people had anything to say about trying to manage or the fact that a window wasn't open, or to seek out trying to open it, to try and open it themselves. This was in huge contrast to the other infection prevention measures. You know, we hear a lot about the wearing of masks, and we were hearing this morning that that's a very common complaint to bus operators, like, can you make sure that people are wearing a mask? But people aren't complaining, can you make sure that the windows are open? And we think like that shows that this message has not got through, and yet actually it would add huge amounts to actually making the bus environment that little bit safer to people if there was fresh air flowing in. Okay, so the last slide from my little section. So I guess I just want you to take away this language of thinking about how the normal bus environment has been distorted, and about how people have responded to that distortion and who still clings onto those ideas that it's just not the same. You know, even when it started to look quite a lot like things were back to normal only about a month ago. There's this massive challenge about the invisibility of the COVID threat. And I guess we're trying to work out how can we work with people and to improve understanding about this invisibility. It is invisible on surfaces and in the air, and that creates challenges about how people respond. And yet we know people are responding. We're all changing what we're doing because of this invisible threat. So it's trying to look towards those behaviours as a way to explain how people can respond and to support those good behaviours that actually are closely tied to what is known about good infection prevention. And thirdly, that there are lots of new feelings that are being experienced on buses, caution, alarm, that are associated by those people who are taking the bus now, but also people in the past. But we've also got really good evidence of when people actually felt a lot of confidence. For example, when there was lower capacities on the bus, those people who kept taking the bus at those times, they spoke very positively about what it felt like. And it actually was incredibly daunting for them when the bus got full again. That's when they had panic attacks. But people have been growing in confidence about taking the bus again. And so that it's definitely possible for people to go through that personal journey of feelings and move back into a more confident state. But obviously where we are today with Plan B being reintroduced, we're back into a more anxious time again. But this is the experience of the pandemic, isn't it? Things keep changing. Okay, I pass you on now to Sandra.
Thanks, Emma. Good afternoon, everyone. As Emma and Paul have said, I'm a microbiologist, and I've spent most of my career in a small dark room looking down a microscope and being able to look directly at these microbial communities. So I often, it's no surprise to me that there are microbes all around us, and I find that quite easy to visualize. But of course, for the majority of people, that isn't the reality. Most people don't get to see these communities. And one of the things that has clearly come out of the pandemic, first of all, I've never had so much interest in my job as a microbiologist, because everybody's now interested in microbiology and everybody has become an infection prevention specialist. That was something that was very much in healthcare really only before. So it's interesting to look and use the bus as an example to see what's there and how we can help understand what's there and communicate that to people. So I always think that the first thing is you're never alone on the bus. We've got these microbes that are traveling with us and on us, and we need to become more familiar with that. If I can have the next slide, please, Paul. So just a little bit of background. It really is a microbial world. We've got microorganisms everywhere. There's just about no environment that we've been able to sample that doesn't have a microbial community within it or on it. So that can be everything from in rain clouds and soil and glaciers and deep sea vents to in our homes, our cars, our offices, any public space, and on and in us. And one of the things I always say to my students when they're starting microbiology, and it always feels a little bit disconcerting, but the estimates of the number of microbes in our GI tract and on our skin is at least as much, and if not more in number, than our total number of human cells. So you can almost think of us as being more microbial than human, which is an odd concept, but it shows how closely we are living with this microbial world. And microorganisms are very complex. They rarely exist solely on their own. They exist in communities, and they can form really structured communities on surfaces and on different materials. So a really easy one is it's sort of midway through the day, if you run your tongue over your teeth, it starts to feel a bit rough. That's plaque starting to form. Plaque is something called a biofilm, which is a community, a structured community of microorganisms that's starting to colonize the surface. So far more complex than that idea of a single cell. And there's been several studies now which have shown that all spaces that we use become colonized rapidly. So as soon as people enter a space, we will leave parts or bring parts of our microbial populations with us, whether from the external environment or from our own skin, for example. And one of the things which often gets debated in microbiology research is thinking about this concept of clean and how clean do places need to be. And if you start thinking along the lines of, well, there's always microbes around, you start moving away from the idea that a place has to be sterile, has to be completely free of everything, because we do live with all these things all the time quite safely. And we will always share ourselves, our spaces, and indeed our air with microorganisms. We're not in a sterile world. We can have the next slide, please. And the other aspect of that is generally when things around microbiology are communicated, we're more familiar with the idea of microorganisms either being good or bad. So on the one hand, you have the bad monsters on the bleach adverts, where you need to kill 99.99% of them, and they're nasty and we need to get rid of them. Or you have, in contrast, the sort of good gut bacteria in your yogurt drink that you should be having every morning to boost your gut microbiome. But actually it's far more complex. Our relationship with microorganisms and these populations is far more complex than that. And indeed, each individual has their own types of response. So certainly linking to immune systems, we all have different levels of immune response to things. And one of the things that's coming out with the different variants is how people are going to be able to respond to those variants, how their immune systems will respond, and some of the differences we're seeing with the vaccine actions. So it's a really complex relationship. And it is important to know that currently in our understanding of all microbial species, so that's bacteria and viruses and fungi, only around 1% of them are actually disease-causing, potentially disease-causing to humans. So it's actually quite a low percentage. You know, there's a vast majority don't cause us any harm at all, but that's not always something that most people are aware of. And especially not at the moment where there's a big feeling of getting rid of everything. You can move to the next slide, please. So there's a real need in general, to understand this invisible community and help people understand that we really don't need to aim for sterility. We just need to understand risk better. And if we understand risk, then we can be safe in an environment. And that hasn't always been communicated in the most effective ways. You can move to the next slide. So within this project, as Emma has said, we're carrying out a microbiome study on the bus. Now we're predominantly focusing on surfaces, and there are particular reasons around this. One of the main ones being that aerosol sampling has a lot of technical challenges, and the amount of time that's required to collect a large enough sample to be able to detect anything makes it very difficult to do in a public space, especially a confined public space like a bus, where passengers may not feel comfortable at all with a machine whirring away for a few hours next to them. And also it has been, from all the studies that have been carried out in real life settings, very hard to actually detect the viral particles. But when you think of these complex communities, if we look at what microorganisms are on the bus by carrying out a general microbiome survey, we can start getting an idea of how cleaning interventions have helped, what's there in general. What are we finding? Are there any areas where we find higher density? That kind of thing. So we've really been looking at understanding the diversity and prevalence of bacterial microorganisms on a range of sites. So different material types. So we've sampled plastic, glass, stainless steel, fabrics. We've looked pre and post cleaning, and with varying passenger density. So we started with taking samples at the end of lockdown, and then as we moved into the early summer, where we had very low use of the buses. And then we have been doing regular sampling since the middle of September, fortnightly on the same bus route, first thing in the morning before the bus leaves the depot, so it is going out completely clean, and then at the end of the day when it returns to the depot, so after it's had a full day of use. And we're using a range of methods, so we're including some advanced methods to help us understand what's there. At the same time, we are looking for viral particles on these same surfaces, but as I said before, you know, all the studies so far have found it very difficult to detect viral particles. But we hope in total that the data is going to illustrate that we're surrounded by these communities and start more general conversations on how we can understand better our links and our relationships with them. We can move on to the next slide. So very briefly, to look at the methods, we're using a validated swab technique, and we are sampling over 20 sites on a number of buses. We choose the same sites on every bus, and we have a defined area that is swabbed at each site. The microbes are then released from the swabs into a solution. We detect bacteria by culturing onto different agar, so that allows us to get a total bacterial number, but it also allows us to split into environmental species. So these might be species coming in from soil, for example, on people's shoes, but also skin associated species. So we're calling them more the human species. So things that we're bringing in on us. An added level to that is that we're carrying out sequencing. So we're really going in deep to understand exactly what's there. So we'll be able to, when we get all the data back, and I should say this is just interim at the moment, we're waiting for all the data to be fully analysed, and hopefully very soon we'll be able to communicate the full data set to you. But the sequencing will allow us to really look at exactly what's there. And at the same time, we're using a PCR molecular technique to look for the presence of SARS-CoV-2 virions on these same samples. You can move to the next slide. Thank you. So this is just really showing on the left-hand side a schematic of the lower and upper deck of a bus and where our different sampling points are situated. So these cover the entire area of the bus with a selection on both decks, and as I say, covering all the different material types that are found on the bus. And on the right hand side, we've just got some examples of our culture techniques. So on the top images, we've got total bacterial counts and our agar that we use for these environmental species. And then we use blood agar for human-related species, so we can start getting an idea of where the bacteria are coming from. You can move to the next slide. So in a very general sense, what are we finding so far? And as I mentioned, we're going to be getting the full data set very soon, and we'll be happy to communicate that in more detail. We are finding that the numbers of bacteria do vary from bus to bus and from sample to sample. But there are some trends. So one of the things that we clearly see is the high touch point areas, such as the grab rails, the stop buttons, any of the handles, have very low, or in a lot of cases, undetectable numbers following cleaning. But with increasing passenger use or through the day, you start seeing the numbers going up, and that would be expected as people are touching them. But there's a really clear result there that the cleaning that's employed is really doing its job. It's really removing what is developing across the day. There are differences between different areas. So for example, seating has more of the human species, while floors have more of the environmental species. Again, we would predict that, but we can absolutely show the data to prove that's the case. So on the seats, the majority are coming from ourselves, which makes complete sense. And what's really interesting is if you compare what we're finding, our preliminary data, against other studies of public and shared spaces, the amounts and the diversity that we're finding are very similar to those spaces. So domestic settings, offices, and even hospitals, we're finding similar levels. And that goes back to what I was saying at the beginning about how we have microbes around us all the time, and that's not a bad thing. And they will always be there. And we need to get more used to that. We need to understand that. But what is really clear is that we do need more research to understand properly the link between the communities and risk. This remains poorly understood, and we don't really know whether something being there is actually a problem. You can go to the next slide, please. So how can we use this information? Well, we're hoping that by understanding the distribution and composition of these microbial communities, we can help to start educating people more generally about risk and the fact that they're surrounded by microbial communities. And definitely in a practical sense, using the information, we are able to show how simple interventions such as touchpoint cleaning, mask wearing, hand hygiene can impact on microbial communities. We can see a clear impact of those actions. And all of this is working towards making the invisible microbial world visible. And if we move on to my last slide. So just to summarize on this, we're sort of really looking at the fact that it's rather unfair that buses are often declared dirty. The buses themselves are actually clean. It's not the bus that is the problem. Much of the dirt or the perceived dirt is due to passengers bringing things on with them. And that could be something like litter, or it could be their own viruses, bacteria, fungi. And so we need to really get people to understand that we have this complex relationship. And also the other key message around surface cleaning, you know, that the cleaning regimes that are being implemented are working. The microbial communities are being reduced from the effects of cleaning. But again, we come back to that issue of how clean does the space need to be, and we don't fully understand that risk. But as we go through the study, we're hoping to be able to understand that a bit more. So at this point, I will pass over to Charlotte.
Thanks, Sandra. So in this section, what I want to really do is discuss passenger experiences of public health measures and the real importance of culture and cultural understanding in adhering to public health messages, the challenges of language in COVID-19 communication, both the kind of scientific side, but also thinking more around multilingual elements, and more widely the cultural values that drive confidence in science and or specific individuals. So if we can go to our next slide, Paul. So I'm actually going to start with the takeaway messages. The first is that there's been confusion about the science. This includes on COVID-19 infection risks, around spread, around the vaccine, and kind of spaces of perceived high risk, including the bus, but also misinformation. And this really requires us to think seriously about the important role that social and cultural dimensions play in public health adherence. The second is around simplicity of government guidance. We know that government guidelines about how to behave were actually initially widely understood and adhered to as the way to kind of stay safe by bus users. But the reasons for doing so were not. And communicating science simply through appropriate mediums, but also through language, is really key to achieving collective behaviours and confidence for those travelling, including by public transport, many for whom English might not be the first language. And my final point is around reducing effectiveness of COVID-19 messaging. So we've known as the pandemic has continued that the government's really quite simple messaging has become less effective. So science communications have become more confusing because of microbial evolution, alongside the political shifts in public health guidance and rules, which have really sought to be attentive to the really negative economic and social impacts of the pandemic. And different types of bus users have increasingly made their own decisions about how to behave in and around taking the bus. And therefore, I think what we would argue is that there's a need for new, novel ways to engage users with public health measures in ways that translate across communities. Next slide, please, Paul. So although people seem to be getting information from across various sources, the government's early simple messaging of hands, space did appear memorable for many, and several of our respondents repeated these phrases to us, but often without clearly knowing what was meant. Few of them, however, were aware of the updated version that Emma's mentioned, the inclusion of fresh air. And we've identified that shorter messages with clear visuals are really important for conveying quickly and simply to non-specialist audiences. And I think bus companies recognise their corporate social responsibility to provide practical but also informative advice on bus travel going both for kind of hard messaging through signage on board and notices on board the screens, but also through kind of softer messages, including like taping off of specific seats. So next slide, please, Paul. There was particular criticism about how public communications from the government were not translated for minority communities. So speaking about his local Somali community, Ahmed felt that many members didn't have the education to understand the scientific news about how the virus spread. And we know that the Somali language has a relatively new written form, and therefore scientific terminology may not be easy to translate. When some respondents spoke about their kind of know-how about how the COVID virus was spreading, we kind of sensed confusion and scientific misunderstanding that really resolved into tending toward believing in conspiracy theories. And members of the community didn't know why scientifically they needed to behave in a particular way, but were instead often reliant or completely reliant on behavioural guidance and instruction. Next slide, please. Many of our research participants for whom English was their second language expressed concerns about this kind of fluctuating information and therefore turned to diverse members of society for clarification. And this included family members and friends, but also often faith leaders, many of whom would have had differing scientific expertise. Our bus users shared with us their opinions about what they knew, what they felt and understood, and who or what they turned to for information or trust in what the right way to behave in relation to the virus was. In this example, faith leaders emphasised the importance of doing one's duty to protect self and others. And I think what is clear is that there is a diverse array of information sources that continue to be drawn on. Some people we spoke to were very reliant on news media and a government announcement, while others tended towards social media and kind of peers or religious leaders. Next slide, please. So some of our interviewees were aware of disinformation, but they didn't necessarily feel they could access information they understood as from a trusted source because of the lack of a translation button for kind of non-English speakers. So language barriers to public health information were identified as a real key concern and detrimental to their public health practices. So this included the advice to socially distance, to wear a mask and to improve ventilation through letting fresh air in, which is directly transferable to shared social spaces such as buses and bus stops. But some of the evidence from our interviews is that these messages about fresh air in particular were not getting through. So the information from the news is kind of confusing. On the government website, if they had some kind of translation button, people could be like, okay, this is a website that they wouldn't be having misleading information on. Next slide, please. At the start of the pandemic, people were often more fearful of the unknown, but as their kind of personal experiences of living in a pandemic world grew, they became often more skeptical about some of the guidance and instead more kind of assured in what they knew worked, because up until this point they hadn't caught the virus nor knew of anyone who had, or alternatively, they simply felt they couldn't cope with the kind of ongoing COVID-19 news onslaught. So we hear about, I didn't listen to the news that much. So the lack of personal experience of someone with COVID for certain individuals seemed to lead to a certain set of more risky behaviours, as they kind of doubted the virus's existence. And with that, there became lax at following good infection prevention measures, placing, we would argue, such communities at even higher risk of infection or even death. So here, you know, because I didn't protect myself for nothing and I still got nothing. So be honest, I don't know what is going on. So I think what is really shows is, or raises questions about, is the need to find different ways of engaging wider publics with scientific information and assurance in good public health behaviours, but also ways that are culturally sensitive and or find points of connection that are familiar. And one of the ways that we sought to think about this was finding, you know, shared analogies that people could turn to, like the football analogy. So I'm going to hand over to Paul now.
Great, thank you, Charlotte. Yes, I'm just going to talk briefly about our approach to public engagement that developed out of what we learned from the interviews and from the microbiology and our thinking about how the pandemic has been communicated. And so hopefully this will, you know, we'll also get a chance to talk about some of these issues as well in the discussion. So we sort of committed to making some films about infection prevention on the bus. And as the project developed, we sort of set ourselves a set of aesthetic parameters, a set of kind of rules or objectives of how we wanted to approach the filmmaking. And so one of them was to kind of represent the human and microbial communities on the bus. As we've heard from Sandra and Emma, you know, the microbial landscape of the bus is made up of these kind of interspecies, multi-species communities. And we also wanted to kind of take away from perhaps the human-centered aspect of it. We wanted to focus on non-human characters in the films. And you'll see, I'll show you one of them in a moment, see how we've done that through sort of animating aspects of the elements of the bus architecture. We wanted to use humor and kind of imagination instead of shock tactics or didacticism. Obviously, a lot of the sort of more formal government messaging has been quite didactic, telling us what to do. And whilst we know that there is this gap in knowledge or people's sort of scientific understanding, we also didn't want to do something that was sort of directly educational or kind of conventionally educational, because we also recognize that there's a space for kind of curiosity and imagination to make up the microbial landscape as well as scientific knowledge. And so as part of this, we wanted to create positive rather than negative messaging, to sort of give people confidence perhaps rather than instilling fear in people. And we didn't want to anthropomorphize or monsterize microbes as individuals. So as Sandra was talking about the sort of bleach advert, little bugs that are jumping out of your plug hole, yeah, we didn't want to do that, because that's not what microbes are. Microbes are these sort of complex communities that we have all sorts of interactions with. So we wanted to sort of try and do that in a sort of interesting and novel way. And the challenge of that was to kind of acknowledge that microbes are largely invisible to us, but that we also wanted to somehow represent them. So we set ourselves quite a challenge, but it was a lot of fun to kind of respond to that. So I'm just going to try to share the films, if you could just bear with me while I do so.
A bit chilly today.
Yeah, that one wants to shut me up.
You do go on it.
No, they want to shut the window.
There is a bit of a breeze.
But you got to keep me open. Keep the bus breathing. You air in, hold air out.
Yeah, fresh air shows you care.
Even in the winter.
And I'm just going to move on to the last one.
Hello, where did you get on? I've not met you before.
Hey, Sammy, who are you talking to?
To my pet micro passengers. I've got quite a lot on me now.
Us too. They're mostly nice though.
I like them.
I don't.
Oh, here it comes. That feels better.
I think I've got a stinky one.
I didn't want to say anything.
I can't smell anything. I'm just chilling with my pet micro passengers. But these guys get a good clean because human hands touch them.
No micro pets allowed.
Like on us, right? Oh yeah.
Feeling fresh.
Looking good.
Let's see who gets on next.
And see if they can't keep their micro passengers to themselves.
Great, thank you. Thanks, Ines. I take it that was a lull of enjoyment. I'm just going to now invite Dawn from Bus Users, who's going to give a bit of insight and perspective from Bus Users UK. If I can hand over to you, Dawn.
Yeah, thank you. I'm Dawn Badminton-Capps and I work for Bus Users UK, and you nearly got it right at the start, Paul, but our mission is to campaign for inclusive and accessible transport. So the pandemic and the work that Southampton University's been doing is really, really important to us because we want to make people feel like the bus is a safe and accessible place for them. But I suppose some of you who might not come from a transport background might be wondering why Southampton and Newcastle have been looking at this particular area. And I think it's just key to highlight that buses are our primary mode of public transport. Over 60% of journeys are done by bus. That is a lot of people using that particular mode of transport to get around and do their thing. That's lots of people who need those buses, whether there's a pandemic or not. And in some areas, some of our large regions like Greater Manchester, Bristol area, that can rise to 80%. So there's a lot of people very, very dependent on buses. So it's really key that we get them back on the bus. We also know that the most vulnerable people in society are the most reliant on bus services. And we know that there's a proven correlation of 10% improvement of connectivity with buses gives us a 3.6% reduction in social deprivation. So we're not just talking about huge numbers of people using the bus, we're also talking about people who are dependent on them, clearly. And I think the thing with buses as well is for all too long they've been considered the Cinderella of public transport. They're often viewed as kind of second class and not nice and safe and clean, and probably for a lot of us that's an inherent view that we had as young people, or for some of us that were alive in the 80s. You know, buses weren't quite so grand back then, and it's a thing that we've really brought with us. But the reality of bus services now in the kind of 2021 is that they're a lifeline, particularly in urban and rural areas. They essentially get us to our schools, our work, our shops, our essential services, our friends and families. You know, they do all the things that we need them to do. And in fact, they're so important that they contribute, people who use the bus contribute around £64 billion worth of goods and services to our local economy. So it's really super important that we make people feel like they can use the bus, particularly if we're going to come out of the pandemic in any kind of economically strong way. The buses also obviously have an important role to play in decarbonisation as well. So again, the quickest way for us to move to zero emissions is for more people to use public transport, not to buy electric cars. So again, it's another reason why we need to make sure that people hear this messaging and feel safe to return to the bus. Because throughout the pandemic, buses and coaches still operated. They may have only had 20%, 30% of the passengers they would normally have. But those people that were using the bus were our essential workers. They were the people we were depending on to be in our hospitals, to be at our doctors, to be at the supermarkets, to drive our buses, to get us places. So again, we really need to kind of make sure that we're being very clear about what buses do and what buses actually contain within that kind of bus environment. And we really need to move away from the very unfortunate and what was negative messaging of returning to car, because as I think the scientists and the geographers have found, buses aren't really that unsafe. You know, they're not carrying lots of COVID, and actually from work we've heard from partners is there's hardly any deaths linked to COVID and people on buses. So the situation that we ended up in that people were being told not to get on the bus and go by car, it really didn't sit with anything else, and again kind of links to the mixed messaging that a lot of the people you surveyed were actually experiencing. People didn't know whether they were safe to do those things, and balancing up those risks alongside with should I be working from home, etc. It really kind of made the whole thing super confusing and super difficult for bus passengers and alike. And kind of touching on that point about not understanding the fresh air throughout the pandemic, bus users support people with complaints to bus operators, and we have virtually no complaints about people complaining about the bus having the windows open. You know, there's the odd one or two, and particularly now winter is coming and we've had a bit of snow, etc. We're not getting those complaints. It was always related to, is someone wearing a face covering or someone sat next to me, and you know, I don't think they should have sat next to me. So I think that really enforces that fresh air message was really lost with people. So I think we really moving forward need to reverse the impact of the messaging that was out there and that confused people. We cannot as a society support a car-based recovery. It's damaging to us in all sorts of different ways, and I think that's why the work that Southampton and Newcastle have done really kind of evidences that we need to do something more positive. We need to let people know that their buses are safe and that it's okay to get on them, and that if you follow these simple measures that you may follow in shops and all sorts of other places, you'll be all right on the bus. It's okay to get back on there, and I think it's just super important that messaging is shared. And I really thank you as a group of people for coming together and working on this piece of work. I think it's really valuable. Is that all right, Paul?
Yeah, brilliant. Thank you. Thanks so much, Dawn. That's really nice and really helpful. Yeah, just to kind of put it into perspective a bit, and yeah, just to echo that, you know, to thank everyone who's come along today, and who's sort of been in dialogue, some people for longer than others, sort of through the project, and just helping us form, you know, start this conversation really, because it feels like, you know, there's lots to talk about and lots to work out in terms of how we bring together these concerns about public health and public transport, and how we communicate this sense of buses being safe places for people to use, and making sure that they're safe places for people to use. So yeah, so we've now got about around half an hour for discussion. So I guess first it would be great to hear any kind of immediate questions or comments that people have in response to any of what we've talked about already. I can see Dave